Hello and welcome to the Healthcare Executive Insights podcast. My name is Elliot Sloan with the Macallan Group. Today's guest is Miss Deborah Ailiff, who is the president and CEO of Procare Integrated Health and Transport. Deborah, thank you so much for taking time to chat with us today.
Thank you for having me, Elliot, and thanks to the Macallan Group, and hello to all the viewers.
Yeah, it's our pleasure. So, Deborah, tell me a little bit about how you got into the healthcare transportation industry and what caused you to create Procare Integrated Health and Transport.
Yeah, so I was an attorney practicing law. My husband was a firefighter EMTB in Baltimore County. So we came from one real estate family and one fire department family. And we decided to start this business, hopefully as a legacy for our family, back in 2005.
That's wonderful. And what were you seeing as far as the void in the market that you were trying to fill? What was the problem you were trying to solve?
So transportation is a very challenging business to be in. And we saw from my husband's experience as not only an EMT for the fire department, but also for private EMS. He saw a lack of patient satisfaction and a lot of delays in care. And we thought maybe we could add to that. And also it was a call to serve for us to do together.
Sure. So tell me a little bit more about the actual services you're providing at Procare and who are your clients?
Okay. So we provide all types of medical transportation from wheelchair van to basic life support, advanced life support, to the most critical care patients in the state of Maryland and the District of Columbia. Our clients are hospital facilities and some insurance companies.
Sure.
And we also, a new service line I'd love to talk about later on in the conversation is mobile integrated healthcare. We're the only private EMS company providing mobile integrated healthcare. We were approved to provide this service during the pandemic. And we're really excited to talk about that because we think that brings a lot of value to healthcare.
Do you believe that healthcare in the home will be more and more prevalent where, we know with the pandemic, people tried to stay out of hospitals as much as possible. Do you think that trend continues moving on into the future?
Absolutely, as long as it's appropriate and not abused. Yes. And I think it makes sense. Inside the four walls of the hospital, the cost is greater. With our services, we can provide some of the same level of care with a paramedic. So again, it's using your providers in the most cost-effective manner. So using everyone to their highest level, and there are a shortage of nurses. So we're able to provide these services. 95% of what we do is paramedic based, and we use our nurses about 5%. So that also helps.
So tell me why health systems need to work with third parties like Procare versus having their own internal transportation service line.
There are some healthcare systems who do have their own transportation service lines, but they far and beyond use private commercial ambulance services in partnership to augment their services. And we're always in need. There's just such a demand for our services.
Yeah, that makes a lot of sense. They can't do it by themselves. They need a reliable company like Procare to go through the ebbs and flows of the volume of calls and requests that come in for transportation. Now, tell me, what do you believe are the most pressing issues for health systems going into 2023? What are you seeing as far as the biggest pain points for your clients?
So first, from my perspective, again, as a private commercial interfacility medical transportation company, also providing mobile integrated healthcare, my world is small. So we are one small piece of the continuum of care, but it's many, and we observe a lot in hospitals and with our hospital partners. I guess the most pressing is what the pandemic's done to healthcare. I would like to name a few that need to be named, but I think the most pressing is what the pandemic's done. For instance, equity in healthcare is a major concern. Mental health is a major concern that needs to be tackled. How to better care for patients in the home and technology. How are we going to be innovative? What are we going to do in the next 10 years? What is it going to look like in the home? And getting that hospital at home idea really implemented in all states. And increasing efficiencies, value-based care, very, very important. And like I said, the most pressing is the staffing crisis. So we're having a major staffing crisis, not just EMS, in hospitals as well. There's a major nursing crisis. Home health is in a nursing crisis. And it's coupled with these rapidly rising costs. For us, in our little world, it's gas, it's supplies, it's medical supplies, and of course your hourly pay rates for paramedics and EMTs and nurses. It's all gone up by 30-40%. So that's a concern, considering reimbursements haven't been increasing, not nearly as quickly enough to catch up with the rising costs. So that's our challenge, and the demand is higher than ever. So we grew 30% over the last 2 years, and trying to keep up with the staffing and being the most desired place to work. And being able to meet the needs of our healthcare partners with these rising costs, it's very challenging. So, for example, not to get too much into the weeds, but when we drop off a patient at the ED, any local ED, and some are worse than others in terms of their staffing, we may be waiting in the hall with a patient on our stretcher for 2 to 6 or more hours. You can imagine what that does to the total turnaround time for our patient transports. What used to take 2.5 hours or 2 hours might take 6+ hours. So we're having to provide more resources for the same volume, and our volume has increased. So you can imagine what it's like on a daily basis to fill our schedules. And this isn't just Procare, it's industry-wide, and it's also in our hospitals. It's being echoed in our hospitals as well. And the 911 system. The 911 system is suffering as well when they have to wait in the hall for a bed. And frankly, hospital staff is frustrated. It's not their fault, but we're all in this together, is how we put it, and we're dealing with it on a daily basis. And you can imagine what it does to delay the next patient. So this is what we're really struggling with. The other thing I thought I would mention, I think this is kind of funny. Recently, I saw a podcast. Normally, podcasts don't focus on private EMS. Not very interested in interfacility transportation, the general public anyway. But it was interesting because there's a Michael Bay film out called Ambulance. And because this film was out, and I guess someone found it interesting, there was a whole podcast dedicated to private commercial ambulance. And I thought it was interesting that it was mentioned that private commercial ambulance, they were intimating that we're bad actors, which I thought was ironic. Kind of that we put patient care, we sacrifice patient care and timeliness for profit, which is the complete opposite of my experience, especially post-pandemic, when we have absolutely been sacrificing profit margins to take care of our patients. We've been putting our patients first. We've been paying our staff more. We've been putting new resources on that aren't even required by the state. For example, COVID patients needed high-flow oxygen devices that aren't required by the state. We purchased them in order to make sure that our patients were transported as safely as possible. And it's just kind of ironic that I had recently seen that podcast as I was, just preparing for this one. And it couldn't be further from the truth. So just to give you an idea, our EMS providers and the nurses out there in the hospitals, their job has been made 10 times harder since the pandemic. It was already a hard job. It was already challenging. It's already a service job. They're all givers. And now they're being faced with just massive challenges that I don't think anyone saw coming. So that's probably our biggest challenge. And if we can't figure that out, the staffing and, the reimbursements so that we can provide better resources, we're not going to be able to tackle the other problems, the mental health, and the other things we talked about, equity. A lot of things came out of this pandemic, and especially when you look at equity in care. So those are just some things that were on my mind in terms of our challenges.
Yeah, let's talk about how you've been able to build a strong company culture, and what's your opinion on the importance of a company culture, and what does the executive leadership team do to make a difference?
So we are still working on our company culture. We've always had the mission, vision, and values statements. Safety, quality, compliance, and teamwork. It took me 2 years to come up with those 4 words, but they really do mean a lot to us, and we really take them to heart. But recently, so I invest in my management team every year. We do an out-of-state retreat. We started this just a few years back. And this year we went to Nashville, Tennessee. And so we were, and I think it's really important to invest in your management team, and they need to be a part of the culture and the creation of the culture. So we had 2 different facilitators who were just tremendous. And we learned a lot about company culture, and we spent a lot of time talking about how we want to show up for work and how we want our coworkers and employees to show up for work. And I think the having your managers and supervisors contribute to the formulation of your company culture is so critically important. Because if it doesn't resonate with them, if I'm just sitting there talking about culture and not involving them in the process, how will it ever resonate with the folks who they manage every day, which are our dispatchers, our call takers, our billing specialists, our EMTs, paramedics, and our ambulance drivers. So this was something that we're currently working on. And what we did was we kind of narrowed it down to like the top 25 things that we either think we are or we want to be, because we're never there 100%. We're a work in progress. And I hope that we never seem like, we got it, because it's always a work in progress, and you're always learning. And I'm always learning. And I want to instill that in my management team. So we sat together and we put together this list, and we kind of said things like, okay, we are prepared and ready to serve, right? That's probably number 1. We're prepared and ready to serve. We respect each other in and outside of the workplace. We also said we're kind. We're respectful to each other. Well, I said that one. We greet each other. That's important. We greet each other. We have conversations with each other. We are inclusive. We don't form cliques. We're inclusive. We're positive. We're not always looking at the glass half full. We build up the company in conversations, and we're innovative. We're problem solvers. And I think that's something great about Procare. We're innovative and problem solvers. And I think our industry of EMS, we are problem solvers. So all those things that we are and want to be and aspire to be are coming together and we're creating a culture statement, and we're going to be publishing it soon. We're super excited. And we hope to get the staff involved, and we want their feedback, but that's where we're going with that. And, I hope it goes well, and I'll give you an update.
So what are some things that you've initiated to help attract the right talent and the right minds and personalities and morals to your organization?
Well, we've tried to put together the best hiring package, and we have an amazing hiring manager, and she really does reflect our culture, I believe, and I think that's really important because she's the first face of Procare. So we put together competitive pay rates, very important. Like I said, they've gone up about 30 to 40%. It depends on the staff. And we've also put together some shift differentials for the harder, more difficult shifts to fill, like nights and weekends, because let's face it, no one wants to work the weekend, but we need weekend staff. Also during the pandemic, we're trying to get away from bonuses now, but we were forced to do bonuses, like $100 to $300 bonus during the pandemic, up to $500 for one shift. So you can imagine. So wow. We were really we put a lot of motivators out there financially.
Sure.
But we also do some pretty cool touchy-feely things that I think are cool. I'm not sure everyone buys into them, but I like to hope that it's changing some minds. We do a monthly meditation. So we have this fantastic corporate meditation expert come into Procare once a month. And we usually like to make sure it hits an orientation. So at least if no one comes, at least the 4 or 7 people in orientation experience the meditation. And it's so cool. It's about 45 minutes to an hour. And she does some talking about the science behind meditation. And she does an actual meditation. And we get these amazing responses back. Like, I've never felt this relaxed. I've tried this before, but I thought it was silly, but now, hey, I really like this. She usually sends me some quotes of good feedback. So that's one of the things we did. One of the things that we've done for like 10 years, but actually we haven't started back up on a regular basis yet because COVID, we just had a spike actually. But we had monthly seated massages at Procare. So we have a massage therapist come in and give the EMTs monthly seated massages. And they're like 20-minute seated massage, and it's hard because, as you know, what we do, our paramedics and EMTs are on the road. So we have to try to give them breaks to come back. It doesn't always happen. It's not always possible, but we try to bring her in like right when they're clocking in so they can get that. So we're trying to start that up soon. The goal is to start that up very soon because we discontinued it back in 2020. So yeah. So that, and we try to have like that work-life balance. I would say our employees would say that we're very flexible with scheduling. And that's a hard thing to do. But we really try to work. We understand people have kids, they have second jobs. Some of them work at the fire department and they work for us on a PRN basis, which is, as needed when needed. So we really need to work with people and their different appointments and things that they have in their life. So we try to do that as much as possible while still servicing our clients. So it's a balancing act, but we do have, we actually have a work-life balance logo. It's a peacock. And that's one of the things in our culture statement is we respect each other's work-life balance. And again, it's something we're always striving for, but the demands on us, of course, are enormous. So it's a balancing act, but we try to do that as well.
Yeah. I love some of the things that you're offering to your employees and your team. Of course, everyone wants to be compensated well for their time, service, and expertise, but I think that's not enough nowadays. You have to go a layer deeper, and things like a mindful meditation monthly is amazing. I believe that your physical health really begins with your mental health. And especially being in a high stress environment as an EMS worker or ambulance transportation provider, the fact that you're recognizing the importance of dealing with your employees' mental well-being separates you from other organizations out there. And it probably has a measurable impact on the results that you're getting from your team and the outcomes that the patients are getting from your team, because they are in a much better place mentally and they feel that their organization is giving them additional resources to support them with, a meditation, a massage, flexibility on scheduling, that all really boosts the morale of a workforce and says, we look at you as family, not just somebody who works for us. We want you to be well-rounded or feeling good across the board, not just physically, but mentally. And we want you to have your personal life, and we appreciate you. So cheers for all those things that you're doing. I can imagine you have employees that stick around for a long time.
We do have a lot of long-term employees. We do. That is true. And as far as like what they do with our patients, I can't speak highly enough. As many challenges and frustrations, and we just had a meeting the other day with one of our EMTs who is just so frustrated. She's having problems with the tablet to do her patient care reports. There's not always Wi-Fi where she is, and she was just really struggling with it. And And then we have a lot of bariatric patients, and a lot of times we don't have all the information when we get to a patient. So once we see, oh, the patient's not 150 pounds, the patient's 150 kilos, or whatever the miscommunication was, and we realize we need a different stretcher, we need another team, we need 3 team members to help, or we need, a manager there on site, whatever it may be, and then there's a delay. It's very frustrating for the folks with the patient and family. And I will say that I truly, truly believe that when, they say the rubber hits the road, our staff puts that aside and does a great job for the patient. And the reason I know that is because I do patient satisfaction surveys with every bill that goes out to a patient. So we get these patient satisfaction surveys back regularly. And I am not joking you when I tell you that 99% of them are excellent. Your EMT really made a difference in my life, and I was treated so gently and with respect. We also have a kudos program. When we get those back, this hiring manager I was telling you about, Nicole, she also posts in our community page and on our Facebook page the kudos that we are giving to our staff for the great feedback that we get from patients and each other. They can also get kudos points. And with those points, if you get, say, 30 kudos points, you get 1 more day of PTO. So it's actually rewarding them for the positive feedback. And usually every time someone gets a positive feedback, they get 5 points. So that's something we've been doing for like 8 or 10 years. And we continue to do it through the pandemic, and to make sure that people are told over and over again how much we appreciate them, because we know how hard their job is.
Absolutely.
And we know how frustrating it is. And we know that they're absolutely doing their best. So.
Yeah, absolutely. You got to share those wins with the world, and not only internally, but externally, make sure your team understands how greatly appreciated they are for the work that they do. And they come in and provide every day. They really are heroes in their own respects.
They are.
And, I think EMS has kind of got this stigma where it's like, oh, you're just driving an ambulance. It's like, no, you're saving lives in the back of those trucks. You're administering complex healthcare in the back of those trucks. You are far more than just an ability to get from A to B.
Yeah, that's been a personal goal of mine, to really change that perception, because it is so not true. We have many programs where we're transporting the sickest patients in the state of Maryland to higher level of care. We have multiple STEMI, ST elevated myocardial infarction patients, the patients having the worst type of heart attack. And they may walk into a hospital that doesn't have definitive care, and the hospital is able to call us, and we're able to respond within 15 minutes or less and take the patient to definitive care. We're able to do that for several different hospital systems in the state of Maryland. We've kind of become a semi-boutique boutique ambulance provider because of that.
Wow.
And every day we hear, success stories and really saving lives every day. There's no doubt about it.
Sure.
As 911 is as well. Yes, all of us, all of our EMS providers are doing it, are doing the job.
And your team really needs to get the props they deserve. Without your service, healthcare doesn't work. So you're a big piece of the puzzle. Tell me this. We'll end on this. How is your organization participating in value-based care, and what do you think value-based care holds for the future of healthcare?
Yeah, so the way we've traditionally been reimbursed, it's based on volume, right? So you, just like in the medical profession, in terms of like an MRI, you're billed per test, right? So for us, we're billed per transport and mileage. And depending on the contract, sometimes it's the first 20 miles is included and you're billed for every mile thereafter. It depends on the contract. So I think value-based care is where we start to really look at our outcomes. And that's where those patient satisfaction surveys come into play. And that's why I started doing that many, many years ago, because this is coming. It's coming for our industry, just like it is for the rest of healthcare. And also another way we can participate, and not just our outcomes, that we're able to safely transport someone from point A to point B. These were their vitals. This is how we did the patient handoff to the hospital staff, and the patient, did well. The other way is through these mobile integrated healthcare partnerships. So while now we're doing a lot of gap filling and taking the patient where they may be sitting in the hospital for another 2 or 3 days, we're able to take the patient out of the hospital a few days earlier and fill that gap in care before home health care arrives. We can also help to reduce readmissions and unnecessary admissions into the emergency room. And there are also some 911 MIH programs doing something similar to this. And that is to be able to follow the patient for an extended period of time for like 30 days. And you're able to call the patient, visit the patient, make sure you need to pick up a prescription, do so. They need something fixed in their home, do so. Get them what they need in order to stay safe at home. These are the type of things that we can really add value. And I think because of the lack of bed availability, more of my clients are going to be using our services in order to discharge sooner so they can get another patient in need into that bed. So I think that's one big way. And we can even share in some of that because when a hospital gets pinged with a readmission, with an unnecessary readmission within 30 days, there's certain penalties assessed to them. So we would even be able to share in that. If we can help you keep your patient out of the hospital, don't pay us per visit. Pay us as a share of your upside, the savings that the penalties that you avoid. So those are some of the conversations that we're having with our clients in order to make what we do more value-based.
Yeah, that makes a lot of sense. We see that transition happening with value-based care models and programs between health systems and the payers. But what you're not always thinking about is what are the ancillary services that also feed into that continuum of care? And, kind of going back to what we talked about earlier is healthcare can and should start in the home, and that's going to bring down everyone's costs and is ultimately going to bring down the cost of having insurance for the consumers, their premiums and their deductibles, which are, extremely high for most families. So I think everyone wins with value-based care programs, but there's also some people who don't think it'll work. Why do you think there's people on the other side of the coin?
Well, because it really is a change, and people don't like change, I think, in general, and it takes innovation. So what is that hospital at home going to look like in the future? We really need to innovate, and we're in such a high stress environment right now, all of healthcare, from the administrators down to the bedside nurse and the janitorial team. Everyone is under stress, and you cannot be innovative when you're stressed out. So the first thing we need to do is start to alleviate some of this with more staffing, and that's some of the reimbursement rates need to change.
Yep.
And then once we can getting some creative rooms and some creative environments, and we need to be more collaborative with each other and not work in, like protecting your own little territory, just be a little bit more collaborative. I think we can start to innovate, but I think that's it's a fear that, well, if I'm not paid per transport, how will I pay my payroll? I have the same question. I have to see what it's going to look like. Yep. But they need to be bringing us into the conversation. And I think that's some of the problems. They don't really bring us into a conversation. So I would love to participate more with the insurance companies and CMS and other hospitals. And I do participate with my hospitals and like readmission reduction programs and things like that. But we all have to kind of get innovative and get in a room and figure out how we can best use the staffing that we have, and how to, of course, the technology companies partnering with some of the organizations like Procare to, be innovative, and what can we do in the home with our boots on the ground and your technology. So these are the type of things that, hopefully in the near future, we'll have some collaborative partnerships and discussions.
Yeah, absolutely. I couldn't agree more. And that's one of the goals of our podcast, is to bring like-minded folks together and to open up conversations about challenging topics. And strength with numbers, right? If we're going to actually have change, we need to all come together. And like you just alluded to, put your guard down. Maybe stop looking at everyone as your competitor and look at it as partnership opportunities to have more of a voice and to have more leverage to fight back against things that are just not done correctly as an industry. If we are going to have a big disruption in the way healthcare is delivered, then everyone has to work together. It cannot be just one disruptor coming in and shaking up the cage. It really has to be an all hands on deck effort to have a chance at it. It's a big task, and there's a lot of work to be done. So thank you for sharing your insights and your experiences. I know our audience will find this conversation extremely valuable with some awesome takeaways. But I think the main messages that I got from this conversation is we need to figure out this staffing issue. We need to have more resources to get the right people in these healthcare organizations to keep delivering the care that patients need. The communities will suffer. The community hospitals will suffer. More lives will be lost if we can't figure out how to solve this staffing shortage. And on top of that, small, medium, and large healthcare organizations need to all come together and figure out how they can make big changes.
Mm-hmm. Thank you so much. Your questions were super insightful, and I enjoyed this. So thank you for having me. Thanks.
Yeah, absolutely. Deborah, we will circle back with you in a few months down the road, maybe sometime next year, so we can catch up with you and learn what's the latest and greatest happening over at Procare.
Thank you. Have a great day.
Thanks again, Deborah. Take care now.